Welcome to Digitalized in Stockholm 2023. For our project Emergency, Explainable Machine Learning for Development of Early Warning Systems. This is the Digital Futures ISPP project, and the project partners are Digital Futures. Of course, they are supporting the project, KTH, Karolinska University Hospital, and Karolinska Institute. Here comes the project team. Myself, Shoika Chatterjee, is the PI. Professor Sebastian Meyer from CBH School of KTH is the co-PI. Professor Eric Harlenius is the medical professor at Karolinska. And for his task or the problem in the medical field, this project is dedicated. And Antoine Anare is the researcher who has helped us for this project, worked in this project in the past a bit and had some results to build this project further on. So what is the vision? The vision is digitalization of decision support system in critical healthcare. That is the vision. Why are we doing it? It is saving lives in hospitals by early detection of adverse events using AI. Please note this word early. What are you going to do? This is the explainable AI or machine learning, but trustworthy early warning system. Please note the word trust, because trustworthy systems are very important for medical field. How are we going to do that? This is continuous monitoring of physiological data and also comparing with other individual patient data. Let us explain the project. Let us say there is a baby patient, and this is at neonatal intensive care unit of Karolinska University Hospital. Let's say there is a clinical event, for example, an infection starts. So what happens now? You see this time axis, the red arrow, that which basically proceeds. So time elapses after the infection started. Some point of time, the symptom becomes visible. Symptoms like rashes or fever. Then the medical caregivers intervene. For example, doctors intervene, but that may be too late because by that time, a lot of time already elapsed and damage is already done. So there can be an organ failure, and that may lead to pretty bad consequences like death. Now, what do we wish? We wish to track subtle changes in vital parameters. In medical science, it is known that when the infection or some clinical event happens, then there are subtle changes in vital parameters. For example, breathing pattern changes. So we do the trend analysis, and that may give us some early warning. Using this trend analysis, the early warning will help us for early intervention. And doctors or the medical caregivers intervene much faster, and the time does not elapse more. This helps to save the baby. So the overall scheme looks like this. Let's say this is the patient bed connected with several sensors and gadgets collecting data from the patient. These are the real-time continuous data. We also have lab results and EHR, electronic health record data. All this data goes together to this big data as a big data to the database hospital information system. Please note that some of the data we can collect at 500 Hertz, that means 500 samples per second. So it creates a lot of data for the whole day. Then using this data, we have a decision support system, which is based on these explainable machine learning algorithms, which we'll design. And that provides a risk score or warning or explanations to the doctor. And then the doctor provides a clinical decision to the patient. And please note that there is a reverse arrow because doctors also see the patient condition by himself or herself. Doctor also gives feedback to the decision support system to design, or to improve the machine learning algorithm such that, it is more relevant to the doctor's work or doctor's ideas. It also gives feedback to the database management systems that how to collect this data, what kind of data is useful, how long we need to store the data, all these kind of answers. So the research questions are how to collect data, store, and manage for artificial intelligence. Here, Professor Sebastian Schmeier's expertise comes. Question number 2 is how to develop relevant explainable AI or machine learning algorithms, where my expertise comes. And the third question is how to include feedback from medical caregivers and how to use this system for medical purpose. Here, Professor Eric Hardenew's expertise comes. Now, there is enablers for this project. There is data infrastructure. The data infrastructure is very important for this project. Here, the Karolinska University Hospital and Karolinska Institute together combined worked. They have this Center for Molecular Medicine called CMM, where they have collected the data, in prospective manner continuously and do the analysis. This data is actually helping us. This data is our main data where we are designing our algorithms. And we also have some preliminary results for early sepsis detection. Here you see 3 kinds of signals like ECG, R peak, and heart rate. And we can see the comparison in the table that there is a logistic regression method for sepsis detection, like 0.75, which provides 0.75 accuracy or area under the curve, and our explainable AI and machine learning algorithm provides 0.87, which we are able to do it already. At this point of time, I would like to mention a mobility grant by me, which is supported by Swedish Strategic Foundation to Karolinska University Hospital to pursue AI in medicine. And this grant already helped me to understand or to talk with doctors to understand their need and bring their needs, bring engineering to solve their needs. Now, here comes some detail, a picture where we show 3 kinds of signals, time series signals like IBI, interbeat interval, SpO2, and RF. And you please see that we basically collect the features from these signals window-wise and then try to predict that when sepsis is going to happen. So what is the diagnosis time? And in the right side, you see the ROC curve, receiver operating characteristics curve between specificity and sensitivity. And you can see that when we use more signals, then the ROC curve improves. So this is all our preliminary results. So the project is interdisciplinary. It directly impacts on healthcare systems. It also has data science in medical care given an explainable AI, right? So this is the data science in medical care. Now in the digital futures research matrix, the project fits for rich and healthy life and digitalized industry. It also fits in the research theme trust and learn. Thank you for listening. This is the project website. You may go there and see our progress over the time. This project we are just starting now. Thank you for listening again.